To deliver high-quality CPR, begin with high-quality chest compressions. First, make sure the scene is safe. Approach the victim and assess their responsiveness by tapping them and asking them loudly, "Are you okay?" Yell for help. Use a cell phone to call 911 and send a bystander to get an AED. Check the victim's breathing and pulse. If they're not responding, breathing, or only gasping, start CPR with compressions. It's essential to minimize interruptions in chest compressions to 10 seconds. Perform 30 chest compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For adults, this is at least 2 to 2.4 inches. That is 5 to 6 centimeters. To begin, position the individual on their back on a firm, flat surface. Feel for the end of the breastbone or the sternum. Place the heel of one hand on the lower half of the breastbone. Avoid pressing down on the very end of the breastbone, as the bony tip, known as the xiphoid process, may break off and cause damage. Put the other hand on top of the first hand. Press straight down. Let the chest rise completely between compressions. Your hands should remain in contact with the individual without bouncing or leaning on them. Rescuers who are uncomfortable performing mouth-to-mouth and do not have a mask may perform hands-only CPR and give compressions. CPR for infants is almost identical as it is for children. If an infant is not responding and not breathing or only gasping, give 5 sets of 30 compressions and 2 breaths. In infants, push hard and fast as you would in a child or adult receiving CPR. Move any clothing away from the chest and place 2 fingers of one hand on the breastbone, right below the nipple line. Push straight down approximately 1.5 inches, that is 4 centimeters, at a rate of 100 to 120 beats per minute. Let the chest recoil to its regular position after every compression. Remember that an emergency system dispatcher, 911 in the United States, can also guide you through the steps of delivering basic care, performing CPR, or using an AED until additional help arrives.